Well, I had a referral to Dr. Krochak, which I hadn't yet used. I hadn't yet gotten around to making an appointment because I'm a little phobic about dentist visits. But push came to shove when I cracked off part of a tooth, part of a crown, I think, that had been giving me trouble for some years. And the problem was that I was due to go into surgery in a week and a half, and I thought, if this is the warning, then I need to address this tooth and not have to worry about it a month after surgery. So my first visit to Dr. Krochak was an emergency visit before I was having surgery, and not an ideal situation for someone who is anxious about seeing a dentist. But he was so calm and matter of fact. He took my surgery in stride. We talked about options, what he could do to get me through the next few months, what we would do over the coming months after my surgery. And he made me so comfortable, in fact, that I told him to just go ahead and pull the tooth. It was going to need an implant at some point in the future anyway, and that was a long-term plan. And he just made me so comfortable with how he was approaching it, how he was including me as a partner in the decision-making process. And I said, pull it. So within 15 minutes of meeting him for the first time, he was pulling a tooth out of my head. And I haven't looked back. He's terrific. Dr. Krochak is looking at you as a patient, and he's looking at the impact that a certain problem is having on your eating and on your life, on your emotions, and he's looking at the entire picture, not just of your dental health, but of your quality of life. And I really appreciate that about him, that he's looking at me as a whole person and as a whole patient. And what I also like about Dr. Krochak is, in terms of addressing phobia, he is very specific about what he's going to do, how long it will take, and if he thinks I'm going to experience any pain or discomfort, he'll tell me so. He'll tell me the kind of feeling I'll have and about how long it will last. And instead of stoking a fear, it actually allays it, because I can count. There's always a signal that I can use to indicate to him I need a breather, I need a moment. I've actually never used that signal because he's so completely upfront about what's going to happen and so sensitive to it. And even the little touches, the staff is extremely attentive, very kind. There's lavender aromatherapy burning in the room, and I immediately just calm down because I know my experience is going to be good. I know how I feel is important to him, and that is just as important to him as fixing whatever problem I'm there to fix.